The Determine HIV Early Detect is an in vitro, visually read, qualitative immunoassay for the detection of antibodies to HIV-1 and HIV-2, and the detection of non-immunocomplexed HIV-1 P24 antigen in human capillary and venous whole blood, serum, or plasma. Each Determine HIV Early Detect kit contains Determine HIV Early Detect test cards in a foil pouch, a package insert, and a desiccant package. Also available are disposable EDTA-treated capillary tubes for collection and transfer of fingerstick samples, and chase buffer used for whole blood samples. Determine HIV Early Detect test cards must be stored in the pouch at 2 to 30 degrees Celsius or 36 to 86 degrees Fahrenheit until expiration date. To perform the test, you'll need disposable EDTA-treated capillary tubes, a biohazard waste container, sterile gauze, antiseptic wipes, a timing device, disposable gloves, and chase buffer. Open the foil pouch and remove a 10-unit test card. Remove the desired number of test strips from the 10-unit test card by bending and tearing at the perforation. Removal of the test strips should start from the right side of the card to preserve the lot number which appears on the left side of the card. Return and store the unused test strips in the foil pouch together with the desiccant package. Carefully close the pouch by pinching with your fingers to seal, so the cards are not exposed to ambient humidity during storage. Remove the protective foil cover. The assay should be initiated immediately after removing the protective foil cover from the test. Place the test on a flat surface. Clean the patient's finger with an antiseptic wipe. Allow the finger to dry thoroughly or wipe dry with a sterile gauze pad. Using a sterile lancet capable of producing 50 microliters of blood, twist off the protective cap. Press the lancet firmly against the skin just off the center of the finger pad to puncture the skin. Wipe away the first drop with sterile gauze. Avoid squeezing the fingertip to accelerate bleeding. Collect the sample of blood by holding the capillary tube horizontally and touch the tip of the capillary tube to the blood sample. Do not apply pressure to the finger with the capillary tube. Filling of the capillary tube is automatic. Maintain this position until the flow of the sample has reached between the two marked lines, and pull the tube away from the blood drop to stop the filling. If more blood is needed, apply pressure or squeeze the punctured finger to draw more blood. Place the capillary tube containing the blood sample onto the middle of the sample pad marked by the arrow symbol at an upright vertical position. Do not lift the capillary tube from the sample pad before all the blood has been transferred, because a bubble may form, which will prevent the complete transfer of sample. Wait until all the blood is transferred from the capillary tube to the sample pad. Hold the bottle vertically and apply 1 drop of chase buffer to the sample pad. Discard the used capillary tube, test strips, and any other test material into a biohazard waste container. Read the test result between 20 and 40 minutes after the addition of the sample. Do not read the results after 40 minutes. Interpretation of test results. Antibody reactive. A red control line appears in the control area, and a red antibody line appears in the lower test area of the test strip. The intensity of the antibody and control lines may vary. Any visible red line in both the control and lower test areas, regardless of intensity, is considered reactive. A reactive test result means that HIV-1 and/or HIV-2 antibodies have been detected in the specimen. Antigen reactive. A red control line appears in the control area, and a red antigen line appears in the upper test area of the test strip. the intensity of the antigen and control lines may vary. Any visible red line in both the control and upper test areas, regardless of intensity, is considered reactive. A reactive test result means that HIV-1 P24 antigen has been detected in the specimen. Antibody and antigen reactive. A red control line appears in the control area, and a red antibody line appears in the lower test area, and a red antigen line appears in the upper test area. The intensity of the antigen, antibody, and control lines may vary. Any visible red line in the control area, the lower test area, and the upper test area, regardless of intensity, is considered reactive. Non-reactive. A red control line appears in the control area of the test strip, and no red antibody or antigen line appears in the lower test area and the upper test area of the test strip respectively. A non-reactive test result means that HIV-1 or HIV-2 antibodies and HIV-1 P24 antigen were not detected in the specimen. Invalid result. No control line. If there is no red control line in the control area of the test strip, even if a red line appears in the lower test area or the upper test area of the test strip, the result is invalid and the test should be repeated. If the problem persists, contact technical support.